Today, we're going to talk about the role that exercise plays in improving mental health. We're going to discuss some of the mechanisms at play and how that can factor into some of the decision making depending on what mental disorder you're going to be working with. We'll also talk about the differences between aerobic exercise and resistance training exercise and how one or the other may be more beneficial for certain mental health disorders, and we'll continue to explore the idea that exercise is great as a therapeutic tool, but we also will have to incorporate some of the psychological components to improve motivation and self-efficacy and self-mastery that exercise can bring about that people suffering with mental health disorders tend to have a hard time bringing to the forefront. So we'll discuss those parameters and hopefully give you an idea of some tangible things that you can take away to improve mental health through exercise. One of the things that's good to touch on in these situations is kind of the role that mental health disorders plays in society and why it's important to um, overcome them and have structures in place that allow us to help people get better. We have talk therapy, we have pharmacology, and both of those are great ways to do it. But exploring that mind body concept, that biopsychosocial concept of how to get people healthier is going to be the forefront of, I think, the revolution of mental health and improving mental health beyond talk therapy or in conjunction with talk therapy and pharmacokinetics as well. So mental health disorders have become worldwide burden. They look at it as disability adjusted life years. They call them dailies, and dailies are the combination of years of life lost due to premature mortality with years of life lost due to a disability. With depressive disorders being top of the list, anxiety being second on that list, and understanding that within those mental health disorders, they get further compounded with comorbid somatic disorders that lead to a life expectancy of 15 to 20 years shorter compared to the general population. Exercise has been shown to be an effective intervention with moderate to large effect sizes when you look at the meta-analysis that are floating around. Some seem to be better than others, and we'll get into that. But it has been shown to be just as effective as talk therapy and pharmacology. And when you compare it to pharmacology, it's going to be beneficial in terms of not having the negative side effects that could come along with pharmacology. And it's going to help with other diseases that encompass age, sedentary behaviors, which happens a lot with mental health disorders, things like improves cardiovascular disease, metabolic syndrome, high blood pressure, type 2 diabetes, stroke, cancer. Like exercise has been shown to improve all those things. And it would be easy to dismiss pharmacology and talk therapies and say, why aren't more people prescribing exercise? And based on the literature, the biggest barrier for therapists is, and it makes sense coming from an exercise science background, that they just do not feel competent prescribing exercise to their clients. Now, whether you believe that or not, I think it's irrelevant. I think the understanding that going through 8 years of school in exercise science, seeing master students, seeing PhD students, they have a hard time prescribing actual good exercise science or science exercise training protocols. So I think just based off of that, based off seeing it myself, I can understand why therapists have a hard time prescribing something that they have limited knowledge on. You're going to school for 8 years to focus on psychology or pharmacology. You're very rarely going to get sprinkled in with a nutrition class or an exercise class, and that's just not enough. And we can't expect them to learn that in conjunction with what they're already learning. It would be like asking exercise scientists to know the ins and outs of psychology as they graduate and be able to prescribe psychological interventions to the people that they work with. I think understanding psychology is great for personal trainers and exercise science majors, but I also understand that it's just not something that can actually take place. So the thing we want to focus on is like, hey, how can we get the information out there? How can we create some type of structure to where therapists feel comfortable prescribing exercise as an intervention? And I think one of those ways is to talk about the mechanisms, talk about the benefits, talk about how they can make it in conjunction, put them together, exercise and therapy, exercise and pharmacokinetics, because the research does show when you combine those interventions together, it outdoes the interventions by themselves. So don't think of it as exercise as the end all be all, and we'll discuss why it can't be the end all be all. But think about it in terms of an adjunct to what's already going on, what they already feel comfortable with. And I think one of the ways we can look at it is mental health disorders for a very long time have been thought of as just this chemical makeup of the brain that's dysregulated through serotonin, through dopamine dysregulation, and that's why they come up with all these pharmaceuticals. And I think they think of it as like a brain in a vat, and there's this disturbance, and I think that does a couple of things, because the research shows that there's a lot more going on than serotonin and dopamine and all these other things. There's a social component, there's a biological component, and there's a psychological component, and that's what makes up this idea of a biopsychosocial model to approach evaluating mental health. And I think that is the fundamental way to go, because you're taking in all the different components, and exercise can be all three of those components at the same time. So I think that's the way we want to look at it, and we want to understand some of the obstacles that creating exercise assisted therapy has to overcome. One of the biggest one is lack of rigorous study design that builds off of each prior work with single manipulation, so we can get a better understanding of what exactly is going on, have better definitions of what is frequency, intensity, session duration, and length of intervention. I think a collaboration of psychology and exercise can go a long way in creating clear and concise definitions of these things and being able to put them into practice. The idea of acute versus chronic exercise, looking at things like cardiovascular resistance training. How can we equate for volume? How can we match these things up appropriately? And that's by understanding the different intensity domains that they're going to be training at, and how to best get those. Another thing to be conscious of is just getting larger sample sizes. When you're running interventions, it's a very difficult thing to do, to get large sample sizes. And how much information can we provide to create reliability and replication over the long run, so that we can build on these things? I think that's going to be one of the key approaches to overcoming getting exercise assisted therapy into the practice. And I think that starts with the researchers and what they're looking at. I also think that we should integrate motivational and behavioral strategies in exercise as well, because we are well aware that exercise is beneficial, extremely beneficial for improving mental health. But trying to get somebody who has mental health disorder to start exercising can be an astronomical ask. So we have to think about ways to improve their motivation, their adherence to exercise. We don't want to increase the risk of dropouts, even though the research shows that dropouts of exercise interventions is very similar to dropouts of talk therapy. So there's not much of a distance between those two. But we also have to factor in the healthy user bias as well. People that sign up for exercise interventions are going to be people that find exercise to be enjoyable for the most part. So it's how can we get those sedentary people? How can we get those people that do not like exercise to be motivated and to drive behavior to get there? So I think all these things are what we should be focusing on as researchers to build a better idea. to get into some of the mechanisms at play here, when we're talking about mental health disorders, we know that the research shows that mental health is correlated with cognitive function declines. That declines with age is very similar to the declines we see with mental health disorders. So we see attention not being great, short and long term memory, mainly focus in on negative memories. It's very hard for them to focus and retrieve positive memories due to the way that depression and anxiety and those type of things start to manifest in the body. And yeah, we see those same declines in PTSD, bipolar disorder, that are very similar to the neurodegenerative diseases of Alzheimer's and Parkinson's disease. And we have to ask ourselves, like, why is that the case? What's going on? And we do know that there's a lot of crosstalk between the prefrontal cortex, the hippocampus, and the amygdala, and those white matter tracks that connect those areas. What we've seen in the research is that they start to diminish through long-term depression, right? So you start to see the pruning and the depression, and that takes away some of the synaptic plasticity, that takes away the strength of those synapses to fire together and wire together. And what we've seen with the implementation of exercise interventions is that it's enhanced neurogenesis in those areas and created thicker fiber tracks between the hippocampus and the amygdala and the prefrontal cortex. And like I discussed in the first episode of the podcast, that those interactions help with executive function, help with reducing negative stimuli. The fear response to negative stimuli helps with improve attention to positive stimuli, and it can help reduce reactivity when there's aversive stimuli or fear, and it can blunt the fear response and improve one's ability to make appropriate decisions in the face of a stressful stimulus, right? But we're able to get those connections much stronger. And not only white matter, we see connections growing, but we also see gray matter areas as well. A study done by Bottoli and Saba in 2017 found that a large network of brain areas equal to about 82% of total gray matter can be altered due to the implementation of exercise into daily life. And that alteration and growth can be linked to increased cerebral blood flow and volume, which promotes the development of new neurons. Another contributor is through neuronal changes and growth of new neurons due to the release of neurotrophic factors, things like BDNF and nerve growth factor, which has been shown to be released in bolus in a dose response to exercise. So the longer the duration, the more intense the exercise, the higher the release of these neutrophins that we see. And all this helps form and shape new synaptic plasticity and cell genesis. And people that suffer with mental health disorders have low baselines of these things. So if there's ways to acutely and chronically increase those through exercise, that's going to improve their baseline and allow them to create different synaptic plasticity, different neurogenesis, different ways of seeing the world, right? So it's going to allow them to do all those things. And I think that's one of the big benefits is how can we improve those neurotrophins? How can we improve blood flow to the brain area? And another one we want to focus on is the upregulation of the proteins that happen through exercise, both resistance training and through aerobic exercise, things like insulin growth factor 1, vascular endothelial growth factor, which improves neurogenesis and long-term potentiation, which is needed for memory consolidation, as well as new blood vessels are forming. So we get those new blood vessels. When we get better blood flow, we get better circulation, which is going to help release more of those neutrophins. And exercise has been shown to stimulate that peripheral increases from the liver, muscles, and blood cells. And those are known to cross the blood-brain barrier. So we have to think about, yes, exercise does release all these things in the body, in the muscles, also in the brain. But the things that get released in the muscles and in the body, are they able to go through the blood-brain barrier? What role, what mechanism do they have in that? And when we release the neurotrophins and the proteins, they're crucial components for formation of new neurons, LTP, enhanced synaptic plasticity, and improvements in memory and attention. With most of the release happening, but not limited to the hippocampus area. And exercise has been shown to also have a big expression of klotho, which is a pleiotropic protein that regulates age independent and independent pathways, and that's going to help with the aging process. We talk about lifespan and health span, and exercise and klotho has been very much linked to creating better health spans and lifespans in conjunction with each other. And by doing that and releasing those things, we get this increase in stem cell numbers, increase in a regenerative response, low apoptosis incidence in pancreatic B cells. So we're going to see improvements in renal fibrosis and cancer metastasis, and just lower risk of cardiovascular disease all around. Now, getting back to this idea that things get released within the muscle, and what role does that play in helping things cross the blood-brain barrier? And what we've seen is that skeletal muscle is a secretory organ, and it releases a host of cytokines and other peptides that are classified as myokines within the research. And these structures mediate muscle organ crosstalk to the liver, gut, pancreas, adipose tissue, brain, vascular bed, skin. And what we've noticed is the key mechanisms they're one of the key mechanisms to enhancing BDNF. And some of those mechanisms you guys may have heard of, may not have, but one of them is the cathepsin B, and it's a lysosomal cysteine protease, which functions in intracellular protein catabolism. It's upregulated in both the brain and skeletal muscle following exercise, and it can cross the blood-brain barrier, which leads to increased expression of BDNF, mRNA, and increased BDNF protein levels, as well as increase in levels of neuroprotective of double cordon, which has neuroprotective effects. And then another one, all in conjunction with exercise, is irisin, and that's encoded in. It has its effects in brown tissue, so it creates browning effects in white adipose tissue, and that increases energy expenditure and improves glucose tolerance, which can help reduce type 2 diabetes. But when looking at it, and endurance exercise does this, it stimulates increases in the hippocampus of this irisin, which is encoded in the FNDC5 gene. I know these acronyms and everything can get convoluted, but the idea is that it's activating this gene expression, which is activating this this transcriptional coactivator of mitochondria biogenesis. So think of it in terms of we're improving mitochondria biogenesis and oxidative metabolism in muscle and brown adipose tissue, and this helps improve those gene expressions in the hippocampus along within the body. And they found that boosting the brain levels of the FNDC5 rescues synaptic plasticity and memory in mouse models of Alzheimer's disease. And how does that correlate over to human interactions and interventions? We're not as familiar with, but we do know that we are seeing these gene expressions in mice, and it's been shown to potentially have the same carryover into humans. Endurance exercise has also been shown to increase beta hydroxybutyrate, which is a ketone. It's one of the main ketones that have the positive effect of a ketogenic diet, and that crosses the blood-brain barrier through MCT transports, and that accumulates in the hippocampus. So a lot of this stuff is accumulating in the hippocampus, which is one of the areas of memory that projects onto other areas of to create memory. Because what we know is that if the hippocampus gets damaged, the ability to form new memories gets disrupted, but the old memories stay intact. So it doesn't necessarily destroy old memories; it destroys the ability to create new memories. So that tells us that memories are stored in different parts of the brain, and being able to get these releases of these proteins, of these proteases, of these BDNFs into those areas is going to help with better signaling to those areas, to create memories that are more positive in nature, because that allows you to do that through exercise, through even through some forms of talk therapy. So the beta hydroxybutyrate is neuroprotective, and it's been shown to protect striatal and dopaminergic neurons, which is going to be very important for the neurotransmitters to be released within the brain. And another role that these transporters have is they transport lactate, and lactate is a derivative of exercise. Once you get to that lactate threshold, your body starts producing lactate, which is an energy substrate that the body uses to continue to make energy when ATP becomes deficient. But with lactate, we also get things like hydrogen and inorganic phosphate, which are fatigue mechanisms. But what they found, with the interesting thing with lactate, is that um, it produces glucose oxidation when oxygen uptake is low, and can buffer acidosis, but it also transports from astrocytes to neurons and plays a crucial role for memory formation and increased expression of BDNF. And what they found through the research is that by injecting people with lactate without the exercise, we have seen increases, elevations of BDNF, um, and those help with the potentiation into the NMDA glutamate receptor. So it's all going into this formation of memories, and improvements of memory, and those connectivities, those white matter tracks continue to get stronger and stronger. And other mechanisms at play that improve through exercise that are associated with mental health disorder. We have things like mitochondrial function, which we touched on a little bit, biogenesis, the creation of new neurons, neurotransmitters, and the HPA axis. So just to touch on those things just a little bit. With mitochondrial dysfunction, that leads to impairments in energy production, which have been linked to mood disorders, along with higher levels of oxygenative species. And what aerobic exercise has been shown to do is it's been shown to ameliorate the loss of skeletal muscle mitochondria content, and significantly decrease reactive oxygen species. So, very positive thing in terms of boosting the mitochondria, which is the powerhouse of the body that produces energy. And another thing which we touched on a little bit earlier was this idea that we have these chemical responses in our brain, these neurotransmitters, and there's a lot of imbalances in them. And for the longest time, we strictly focused on that type of research, and focused on serotonin being one of the biggest drivers of that. And we also focused on dopamine and noradrenaline and glutamate now, with the research showing that when you're able to improve glutamate receptors through ketamine, we're able to see a mood increase, and has nothing to do with serotonin in people with depression. So it goes to show that the neurotransmitters do play a particular role, but it's hard to pinpoint just one that plays that role. And that's one of the issues with the pharmacology, is that it's putting in these and adjusting them, and there are definitely good efficacy behind them, but it is just kind of a guessing game, and we have to try to get out of that role of guessing. Even though we want to move people forward and help them with their mental health disorders, I think it's more important to focus on particular mechanisms that can drive this, and that is something that hopefully starts to get looked at a little bit more. I know they're starting to look at that through optogenetics and the lens of optogenetics, and uh, being able to specifically point out different receptors. So I think that'll be the way that we move forward. But one of the things with the neurotransmitters having low availability, the SSRIs, it prevents serotonin and noradrenaline from being reabsorbed. So it's blocking the reuptake, and it's inhibiting the reuptake, so that leaves more freely floating around neurotransmitters. And they think over time that helps improve the brain chemistry. It doesn't happen right away, even though it's reacting right away in the brain, but it does take 6 to 8 weeks. And some people will even see a deficit, a dip in their mental health the first week or two. Anytime you're messing with brain chemistry, it's going to be a big teeter totter back and forth of good and bad, good, adjust, 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 trying to figure out what the right prescription is, what the right dose is. So it's something to pay attention to. And it's something that exercise has been shown to help with neurotransmitters being released in the brain. But from what I've seen in the literature lately, it's not nearly as important as it used to be. And we need to move away from that model, or at least challenge that model more, and come up with a better understanding of it. But another thing that I touched on is this HPA dysregulation that happens when stress is high, and people that suffer from mental health disorders have significantly high levels of cortisol being released chronically, and that's going to cause a depression of or dysfunction in the HPA, and that's been shown to heighten or reduce cortisol production, compromise sensitivity to glucocorticoids, and a hyper secretion of corticotropin release hormones. And moderate to intense aerobic exercise has the ability to attenuate that HPA response to stress, thus improving mood disorders. Marked by hyperactivity of the HPA axis. But one thing we do want to consider is that if we are working with people who have that HPA dysregulation, focusing on how much volume we're driving into them, by driving more volume could create more dysregulation. So we have to really pay attention when we are dealing with that type of stuff, and that could be looked at through simple cortisol blood work, things like that, to see where this dysregulation is going after, some of the hormones that it could be compromising. And another one you're going to hear about too is inflammation within the body. IL-6 is a very baseline. IL-6 is a very keen marker for mental health disorders. People that have mental health disorders have higher levels of IL-6. But what we see within the research is that um, when we exercise, we release IL-6 into the bloodstream, and the release of IL-6 from the muscles actually has a protective effect. It's more anti-inflammatory than pro-inflammatory. So IL-6 has been one of those markers that we've looked at for some time, and are starting to move away from as a predictor. And we're starting to look at things like tumor necrosis factor alpha and interleukin 1 beta as better predictors and things that we should focus on reducing, which the release of IL-6 does reduce the tumor necrosis factor. So it's a good thing because we have these releases of things. So there's pro-inflammatory and anti-inflammatory, and IL-6 kind of plays both those depending on how it's released. When it's released from cortisol, the HPA axis, modulation of stress, reactivity, and anxiety, and any dysregulation of that is going to cause widespread IL-6. So that's the baseline one that they're looking at to associate with mental health disorders. Whereas if you're doing an exercise protocol and say you take blood samples afterwards, you're going to see high levels of IL-6. So that would not necessarily be something that would correlate to what you could potentially be looking at. So an exercise, it helps reduce the secretion of the pro-inflammatory markers. And I think focusing on that and the creation of the release of the anti-inflammatory ones, um, I think that's one of the biggest focuses and the biggest things that exercise can do for improving that. And another thing that exercise does is it's it helps regulate the autonomic nervous system. It helps improve your HRV. And meta-analysis have shown that low baselines of HRV is very much correlated to higher bouts of depression and anxiety. So by exercising, we can see those improvements in HRV and their autonomic nervous system, and we can see reductions in stress by implementing those things, and their ability to cope with stress, which HRV is a predictor of, is how stress resilient you are is going to be predictive in the HRV a lot of times, due to its role in accessing the autonomic nervous system. And we know we can improve HRV through breath work. Recent research in the lab that I work in, we've seen that through cognitive reappraisal and exercise combined, we've seen improvements in HRV. So I think that's one of the things that we can focus on to improve and allow them to regulate, give them the skills to regulate that stress response as much as possible. So those are kind of, in short, some of the mechanisms that aerobic exercise can do and resistance training exercise can do to improve the bio part of the biopsychosocial model. So we have improvements in neurotrophins. We have improvements in proteins and hormones. We have improvements in neurotransmitters. We have improvements in inflammation, HPA axis regulation, mitochondria, improvements in clotho expression. So those are the things that mechanistically is what's going on. But again, understanding the mechanisms is just a small portion. Getting them to exercise and be excited to exercise, that's the biggest thing. But I think it's really important to understand the mechanisms of action, right? Because and that's why it's been shown when you add resistance training and cardio, you're going to get better benefits because you're getting a lot of the muscle secretory, the myokines that are being released from the muscle, and that allows for better access and crossing of the blood-brain barrier. So in conjunction with each other, the research has shown that that's been able to improve better than the interventions by themselves. But we want to focus on also the psychological component as well, and thinking about how we can improve psychological well-being. And I think one of the things that we have to overcome is people that suffer with mental health disorders are faced with negative emotions that can be extreme or very long lasting, and that can interfere with a person's ability to function. Those emotions, the anhedonia, the inability to feel pleasure, reduced motivation, hopelessness, low mood, loss of interest. So you can see these are the mechanisms at play psychologically that's going to make it very difficult for us to get people to want to start exercising and adhere to exercise. And we have to figure out ways to make exercise more enjoyable so that they can overcome some of those things. So one thing that we want to look at is how can we incorporate the emotion regulation strategies, and how does aerobic exercise specifically play a role? So this is looking at more aerobic exercise and its role in improving emotion regulation. And what the research shows is that throughout each process, aerobic exercise plays a significant role in the emotion regulation. So we have the perception, the valuation, and the action. And through aerobic exercise and improving those brain connections, it allows for better reactions to all those. It diminishes the perception by diminishing the aversive stimuli, the negative stimuli. It allows you to pay more attention to the positive. So then your perception of the stimulus in front of you is now lower and less aversive than it used to be. And then it also plays on the valuation phase as well. So if we're able to reevaluate the stress through cognitive reappraisal and being able to improve those areas, that's going to help with that amygdala and functional connectivity with the orbitofrontal cortex and the insula. So that's going to help create more positive moods, and it's going to create more attention to preference, positive valence, and positive stimuli, and decrease perception and reactivity to negative valence stimuli. So it's shifting what they're paying attention to and how they see things. And I think that's one of the powerful things of aerobic exercise and how that can improve the psychological component. Another technique that you can use during this phase that's been shown to create positive benefits is exercise allows for a form of distraction. A lot of people that suffer mental health disorders, they have these intrusive thoughts and they begin to ruminate and ruminate and ruminate, and they just can't get out of them. Distraction is a key way to overcome that rumination, and then from there, as you're distracting yourself through exercise of that, and then you get all those other benefits that allows you to reappraise the situation, you're going to be able to work through things in your mind. And we know that after exercise, mood increases. So those things that are ruminating, those intrusive thoughts are going to be shifted more towards a positive valence. So that's one of the things that exercise can do. And it's focusing on, there's two distraction methods, and they both broadly relate to associative, so paying close attention to one's body and performance, or disassociative, mentally distance oneself from sensory input. So those are kind of the two distraction things that we can use to facilitate. So we can implement that within aerobic exercise to allow for a more enjoyable experience. So by having our the people that we're working with, whether it be sedentary people or people with mental health disorders, I think a lot of this can be applicable to both, by telling them, hey, we want to pay close attention to what your body's doing, how your body's feeling. You're taking them out of their mind and into their body. And that's one of the things that mindfulness and meditation has been shown to do as well. And then you can also teach them, that we're going to be outside and I want you to focus on the trees, the clouds, the people that we run by, the animals, right? That's going to allow for distraction as well. That's anything that we can do to get them out of their head is going to be a positive thing, and it's going to increase the positive experience of exercise. It essentially just gives them a mental timeout, gives them time to relax and get those intrusive thoughts out of their head. And what that also does is it gives them a tool. So when they have intrusive thoughts, when they have rumination, they can say, oh, you know what, I'm going to go for a run today because running helps me get rid of that. So that's going to boost motivation and self-efficacy in terms of them wanting to exercise. And then they found that active distraction had a greater capacity to alleviate depressed mood than passive distraction, or active ruminating or passive ruminating. So passive or active distraction is the way to go. Get them out of their mind and focus in on that. And then during the evaluation phase, individuals will either process the stimuli as positive or negative. So teaching them the tools of cognitive reappraisal, and along with exercise, has been shown to improve the reframing process of the stimulus by eliciting better efficiency of cognitive reappraisals, which allows the individual to see negative adverse stimuli and create it into a positive thing, which can help change their emotional trajectories. So we're focusing on anytime a negative thing comes up, like boredom or pain or being out of breath, right? Reappraising that to a positive thing of the challenge of overcoming boredom. How can I push myself, and what's good about challenging myself, and Also, the more I can push through, my lungs burning and my legs burning, the better my mental health is going to be, the better my physical body is going to be. So we're constantly working on reframing it, and giving them those tools is going to be very helpful in that process. And then exercise plays a role during the action phase by enhancing brain oxygenation and blood glucose delivery, which in turn boosts neurotransmitter efficiency and can improve inhibitory control efficiency in the prefrontal cortex. So this is all happening within the prefrontal cortex, and it allows individuals to critically work through the emotional stimulus and inhibit any negative actions towards that stimulus. Um, there's been a handful of theories explaining improvement in emotion regulation, and they talk about the arousal hypothesis, the dual mode theory, which talks about the U-shaped curve of exercise. When you have very low intensity, you don't really get much out of it. When you're in that moderate intensity phase, you're going to perceive it as more enjoyable, and you're going to get more out of it. You're going to get those mood boosting effects. And then if you get into the too intense phase, potentially that can cause negative effects. Although there was a beautiful meta-analysis that was put out looking at exercise hit as a form of improvement of mental health. And what they found was that, yes, right after exercise, the high intensity interval training had either the exact same response as moderate intensity continuous training, or a slightly higher negative response. But when they continued after 15, 30 minutes, 60 minutes, they did continuous checkups, they found that the high intensity group had actually higher and better improved mood rates and self-efficacy compared to those moderate. So it depends on when they're actually asking these questions will determine what the negative effects can be. So that's one of the things we really want to think about and touch on. And one of the things too that aerobic exercise can do, and resistance training, it can create better self-efficacy, and finding ways to improve self-efficacy by teaching them the benefits of challenging tasks and persisting longer in the face of adversity, right? These are all part of that talk therapy that we can start to incorporate to get them. And the exercise has been linked. It creates feelings of mastery, and it boosts self-esteem, and it's been linked to self-perception and self-evaluation. Individuals who engage in regular exercise consistently demonstrate higher levels of self-efficacy. And that makes sense, right? Like we know that making improvements, making in progress, making steady strives towards your goals is going to improve how you feel about yourself. So being able to set those goals and doing that with your client and allowing them to get these small wins all the time is not only going to boost motivation, but it's also going to show them that, hey, like I can master this, I can be more self-ethical, I can do these things and accomplish them, right? Whereas previously I didn't think I could. I didn't think I could even get out of bed. So we're beginning to build this idea of, the benefits of exercise, but then also like how we can get them to do that. Goal setting, teaching them about what happens. Research has shown that by instructing them on the benefits of exercise, and allowing them to know that by improving these synaptic plasticities, it can allow them to change their belief of who they are and how they see themselves in the world. So I think it's important to create these goals and create these individualized workout plans, as opposed to these basic, everyone should follow this template, because we know everyone has different experiences and perceptions of their mental health disorders and their sedentary behaviors, and how we can understand those things and incorporate different exercises is going to be extremely important. So one of the things to think about is that the mood disorders themselves, they cause impairments and difficulties to the psychosocial interaction. But they found that inpatients at a psychiatric hospital expected to increase their social interaction through sports and exercise. So just the idea of being able to get outside and interact with people is starting to boost that social component, that social dynamic that a lot of people with mental health disorders tend to see collapse. And the research on that Brand et al. Did in 2018, they found that one bout of exercise in patients with mental health disorders reported improvements in mood, physical strength, attention, and appreciation for social interaction, along with a decrease in rumination and tiredness. That's one bout of exercise. So it doesn't take much to start seeing and incorporating these improvements, but we have to get them in there. We have to get them striving for that. And exercise is also one of those things where it allows for the affect cognitive process that maintains the psychological symptoms. So like rumination is defined as like these constant repetitive thoughts and these intrusive thoughts, and it creates these feelings of entrapment and hopelessness, which can form into suicidal ideation. And we see that with mental and physical training, it's been shown to be effective in increasing that cognitive control process and decreases ruminative thought patterns. By combining meditation for 30 minutes and moderate intensity aerobic exercise for 30 minutes, that's what they found in the research. The research was done by Alderman et al. In 2016, and it's been shown that just 30 minutes here, 30 minutes there, can make those improvements. So I think that's one of the things that we have to overcome as practitioners, is this idea that, oh, the exercise bout has to be an hour. That can be so overwhelming for people who have never exercised or who don't want to exercise. What we're seeing is that these quick acute bouts, 20, 30 minutes of exercise, we get them in, get them out, they're excited about it, that can have extremely positive benefits. So we want to make sure that the goals we set for the clients aren't so grandiose that they just feel like there's no way, I'm going to be able to even touch that. So why even start, right? So we want to be able to get that out of their head and get rid of, like I said, we're trying to get them out of their head and into the world, into their body. And we've seen that with like acute chronic exercises, the obviously with we start to see a lot of the benefits right around like the week 6, week 8, but we're also getting those really brief positive expressions of mood and motivation. So we have to capitalize on those. We have to make sure that we're able to continue to build on that. And that's by creating a fun, interactive environment, setting goals, trying to improve that psychodynamic by maybe doing group classes. Like there's a bunch of things that we can start to incorporate, motivational interviewing, reappraisal strategies, emotion regulation strategies, and again, just teaching them the benefits of that type of stuff. So one of the things that we want to focus on is kind of like where do we begin? And again, acute bouts as little as 20 to 40 minutes of aerobic exercise at moderate intensity have been shown to improve anxiety and mood for several hours, along with sessions that fell between 40 to 60 minutes with a variety of modalities. So you're thinking about, having them do a rower for 10 minutes and then lift a bit of weights and then do the stairs. Like you're constantly adding that variety piece in there. What the research has shown is that that's improvements in cognitive emotional processes, such as their mood, rumination, attention, and social interactions and physical strength, that they're going to go up. Meta-analysis by Weinstein et al. 2024, they evaluated a total of 4,669 unique participants and found that general mood states improved significantly from pre to post exercise. And they did find that exercise performed with high intensity was associated with lower positive general mood responses. But again, that was done immediately post exercise. We know that you're going to have higher levels of self mastery, higher levels of doing challenging things and overcoming them is going to improve mood in the long term. So I don't want you to think that high intensity is something that we want to get rid of. We want to throw it in there every now and then to create that challenge, but it's not something that we're going to build an entire program on. So another thing to focus on is maybe what can high intensity exercise, what population can it be used for in a very practical and good way. And one of the things they found within the research is that people who suffer from anxiety tend to do better with resistance training and high intensity exercise because it mimics similar autonomic arousal. And by mimicking that and having control of that, and them seeing that they can control that and them seeing that they can overcome that, that allows them to deal with the anxiety when it comes about, as it does throughout the day. So by having the choice to create those similar automatic responses. And the research kind of points to that as well in mice models. We've seen mice models where when they are freely choose exercise versus when they're forced to exercise, the forced exercise, even though the exercise is the same, the forced exercise has negative outcomes on things like cortisol release, on anxiety, on depression. So we want them to feel like they can overcome those sensations by choice, not by have to. And I think that's a great way to start building this foundation of um, how can we allow them to help with the programming? What do they enjoy doing? What do they find to be fun and exciting? And then we put that in there as a way to create better motivation. And the research shows that by allowing them to pick their first exercise, allowing them to pick their favorite exercise, creates better mood towards the exercise or towards the workout in and of itself. And then within that paradigm, it also has been shown to improve the desire and motivation to want to come back to exercise. So how they see the exercise that they're doing afterwards plays a critical role in whether or not they're going to come back. So how can we have them leave the exercise with a positive outlook, with a positive mindset about it? And one thing they've shown within the research is they took two groups and they had them do aerobic exercise on a bike, and one group started at 0% intensity and worked their way up to 120% intensity. And then another group started at 120 and worked their way down to 0. And the group that started with higher intensity and worked its way down to 0 had better affective mood and positive valence toward exercise. And they said that they would rather come in and do that exercise again versus the other group said that they would not really want to do that one again. So where we place the intensity, where we place these dynamics of what's enjoyable for them, how they feel leaving it, having a cool down afterwards where we do breath work can be something that allows them to shift and control their autonomic nervous system and create a positive mood, a positive outlook towards exercise. So research really focuses on, and they find that the sweet spot is moderate intensity aerobic exercise, regardless of modality, has been has the most research on it, but also has been shown to be the most efficacious for improving mental health disorders. And one of the reasons they think that that's more important than, or it's better than the higher intensity stuff, is because as we get into those higher intensities, as we begin to have that lactate production, that starts to drive oxygen and blood to the muscles, as opposed to when you're in that moderate intensity, you still get a lot of oxygen and delivery of blood into the brain. And they think that with that delivery, that allows people to increase those brain areas, increase that connectivity. But again, we don't want to dismiss any form of exercise. We want to know what the limitations are of them and how we can improve those. So another idea is, what can we do to start to create um, better motivation, behavioral changes? And that's where we start to look at more of these psychological components of introduction to, like, these are some things that we can have with talk therapy that introduces them to exercise. Things like motivational interviewing is a great resource for people. And then getting them out into social environments, letting them know that they're going to be working out with people also that are just starting out or have mental health disorders. So we want to focus on that, and we want to think of what is that optimal intensity, what does that optimal program look like, and a systematic review by Lee et al. Looked at the optimal intensity and dose response of exercise to improve mental health, and they found that all exercise intensities, when compared to controls, saw significant improvements in depression scores, and they felt that moderate intensity is the most effective for anxiety. Um, and they felt that vigorous exercise has the highest probability of being the most effective for alleviating depressive symptoms and stress. Um, and that lower intensity may not be sufficient enough to stimulate the neural and hormonal changes associated with greater improvements in depression. And they found that the minimum effective dose for improvements was estimated to be about 150 minutes per week, and the maximum dose to be right around 860. So there is a dose response. The more you can do, typically, the better um, outcomes you're going to get. So that's one thing to focus on. And although this kind of contradicts the idea that vigorous and high intensity workouts are going to be better for anxiety. Again, it just depends on what the person is suffering from. If they feel that their anxiety controls their life and they can't really get out of it, maybe introducing some high intensity stuff is going to allow them to um, mimic those same arousal responses and then push through and have mastery over it. So what the research shows as a whole is that um, aerobic exercise 3 to 5 times a week, 20 to 60 minutes per session, moderate intensity, and as the individual progresses, we can start to implement some high intensity in there as well. Modality doesn't really matter, so whatever they prefer, in switching it up as much as possible to keep them entertained. And if you are doing one of those longer 60-minute sessions, maybe going from treadmill to stairs to rowing, and just mixing that up as much as possible. And progression, right? So we want to start with shorter durations, less frequency, lower ranges of intensity with gradual increases over time. We want to give them this idea that they can handle this. It's not going to be overwhelming. And then the gradual exposure to exercise, by starting at the low end of duration and intensity before working into some of those higher intensity domains, is very similar to the desensitization techniques that through gradual exposure has been found to be effective in psychotherapy. So we can take some of that psychotherapy of exposure therapy, and how can we bring that about to improve adherence and motivation. So we really want to focus on aerobic exercise, and that's kind of the criteria for that. But also, resistance training has also been shown to be pretty efficacious, right? The research shows that resistance, when compared to aerobic exercise, and 79 participants with anxiety disorders saw similar results in the reduction of anxiety scores. So it's going to go back to how can we bring these two things together? How can we implement them? Create a resistance training program that fits the person, and they create an aerobic program so we get benefits out of both those things. Because resistance training as a whole has a lot of benefits that aerobic exercise may not necessarily give us, right? So resistance exercise helps with muscle and bone loss, metabolic syndrome, fat gain, diabetes, all cause mortality, and has been shown to improve cognitive abilities in older adults, and improvements in self-efficacy and self-esteem, along with physical self-concept, total mood disturbances, depression, fatigue. Like, all these things have been shown within the research with just something as simple as 10 weeks of combined resistance and aerobic training to be beneficial. When looking at the research, the issue is that a lot of researchers do not understand how to create volume matched resistance programs. So we don't know which resistance program is better, and I think that's just because a lot of the psychologists that put on the resistance training and exercise, they don't really think about those things. So again, that can be where the exercise science people collaborate with the psychological people and get something out of it that's productive and that's replicable that we can continue to build on. So another thing to think about is, well, how can we bring all this together, right? We talked about aerobic exercise with resistance training recommendations, anywhere between 1 to 3 times a week in conjunction with the aerobic. Or if they prefer resistance, that would be a great thing to introduce them to. And then we can pepper in aerobic afterwards. We want to give them what they prefer because that's going to create higher adherence. And then the duration, anywhere between 30 to 60 minutes. They found that introducing intensity from low to moderate is going to be better, and training 2 to 3 reps from failure is going to create more of a positive outlook towards it. Training to failure could create a negative stimulus for them, a negative valence perspective. 2 to 3 sets between 6 to 15 reps, and rest periods 1 to 3 minutes. Again, progression schemes gradually increase volume over time by either increasing weight lifted or total number of repetitions completed. There's not much literature on this topic, but in general, a good guideline would be to have a block of 4 to 8 weeks of training, and then we implement a deload week where we decrease volume up to 50% and decrease intensity around 20% to help dissipate fatigue. So understanding those fundamentals of fatigue is going to build up, and that could create negative valence. So we want to have easier weeks as well. So start off easy, work your way to hard, go back to easy, work your way to hard, right? That's a great way to look at it, begin to look at it. So week one, you should start with the lowest volume and intensity. And as the weeks progress, so the intensity and the volume to where the person's able to recover and feel good about training. And then research has found that allowing individuals to have the choice of exercise is going to create a positive valence. And before starting, they're going to be more excited before starting, and then they're going to be more excited whenever they finish. And this can be done with anxiety, depression, PTSD. They found that there's multiple exercise interventions that can improve that. Thinking about things like yoga, Tai Chi, and dance. Because there's not a ton of research on those, we're not going to touch on them too much, but understand like those things, that mind body connection exercise, have been shown to be pretty effective as well. We just need more research on them. So focusing on the things that have a lot of research is going to be extremely important. So the barriers the practitioners have to overcome with individuals, low socioeconomic status, poor weather, time demands, safety concerns, both physical, environmental, low motivation, unpleasant sensation to exercise, and being able to speak to them to help find solutions before they become problems is going to be that first step, right? How can we get rid of those barriers before they even bring them up? And research has shown to improve affective mood states, motivation. Like those are the strategies we should be focusing on. Those are some of the interventions we should be doing, trying to create that type of stuff. So again, motivational interviewing. Research shows that 60 individuals suffering from cardiovascular disease did motivational interviewing and significantly increased their physical activity levels compared to individuals receiving standard care alone. So motivational interviewing is used to promote behavior change by taking a collaborative stance and provoking resistance, elicit the patient's own motivation to change, avoid provoking resistance. Focus their attention on resources and planning for carrying out strategies. So this is where you can get into that goal setting parameter, shifting one's beliefs and mindsets towards the stress response with that emotional regulation, that cognitive reappraisal can also be a great way to improve stress resiliency and adaptation. So some of those things, and we know that we can shift their beliefs and their perceptions just by introducing the ideas of neuroplasticity and improvements in mental health. By putting that into their brains, can also begin to shift their beliefs and create better buy-in. If you can kind of show them the why of why they're doing things, that can create better buy-in. So we want to focus on that, and then one of the last things we'll think about and touch on is implementing some of these strategies of improving positive valence, positive affect towards exercise. How can we do that? How can we incorporate this idea of um, leaving the gym better and feeling better than when you came into it? And that's really going to be with exercise selection, making sure that we choose exercises that don't cause pain, that we choose exercises that they enjoy, they look forward to, they have fun doing, um, and then also choosing exercises towards the end that are low negative impact. So we're not going to do a ton of conditioning at the end, but if we do conditioning, then maybe we'll do breath work to end feeling good and promoting those things. And we also want to think about, can we create a group dynamic? Because we know, based on what we've seen with CrossFit communities and other communities, the more we can get the group, the more it's going to create responsibility, the more it's going to create leadership dynamics and accountability. And that's one of the things that we want. Accountability with like-minded people is going to be something that's really important. Do we exercise out outside? Do we focus on that type of stuff? Like those are things that need to be done within the research to see if those can have better improvements in well-being, and allow them to be more motivated. So some of the steps to move forward is to really try to standardize the protocols in the research and invest in long-term adherence strategies. Um, Explore the patient's perspective. So talking to the patients a little bit more, and just trying to improve our understanding of what's going on. So talking to your clients, talking to people, and getting a better feel for, asking them about, hey, like, how did you enjoy the exercise? Can we do something better next time? Would you want to go outside next time? Like, just having that social component, that talk therapy component of just getting to know them, is going to be one way to improve those dynamics. And I think that's those steps in that right direction. We're looking at the biology, we're looking at the social component, and we're looking at the psychological component. And we're combining those so that we can get better motivation and adherence to exercise, because we do understand that exercise has all these health benefits, beyond just the mental benefits, but it's going to create longer and happier lives. So we want to focus on those things, and making sure that when we introduce exercise, it's not something that creates any negativity to where they may never do it again. So one of the things to really focus on is put yourself in the experience of the person you're working with, and have that empathy, have that understanding, talk to them, get to know them, and that's going to allow you to build a better relationship and better buy-in with them. So that's that's it for the idea that exercise can improve mental health. If you guys have any questions upon listening to it, definitely feel free to reach out and touch base, and we can talk about it. This is what I do my research on. This is what I love to talk about. So if you have any questions, if you have any desire to learn more, just shoot me a message and we'll go from there, and just continue to learn and continue to think outside the box, and find ways to improve the person's experience through exercise.